Cervical myelopathy, again, this is mostly literature-based, although the case examples will be our own. As we've been discussing, cervical myelopathy, common. It's you know, and I'm sure Sig will point this out. To just say cervical myelopathy, it's a spectrum, but when it's reported in the literature, it's like cervical myelopathy. Does that mean, one positive test, a little hyperreflexia, or truly, more advanced? But again, very hard to distinguish in the literature. Traditionally, as we've heard, ACDF, laminoplasties, front back, et cetera. But what about the use of disc replacement for myelopathy? Growing body of literature, cervical disc replacement is probably, if not one of the most studied entities in orthopedic spine neurosurgery, et cetera. A ton of literature. And originally, the perception was we probably should avoid it in patients with myelopathy from, relatively higher grade stenosis. Maybe the thought being that by having persistent motion, there'll be persistent microtrauma to the cord, even with a decompression. But again, what does the literature say? Multiple studies in the literature. We'll go over some of the more recent ones. So what does the literature tell us? Certainly, it was not an exclusion in the FDA trials. It was herniated disc, osteophyte, et cetera, symptomatic radiculopathy or myelopathy.